Norado, and welcome to our daily briefing from the COVID-19 Task Force. It is Friday, March 20th. We're going on 5 o'clock, and we have three speakers who will bring you updates today. We'll start off with Lloyd Phillips, who is the Commissioner of Public Safety, as he has been doing throughout these last several days. He'll go first. We'll be followed by Dwayne Zacharie from the Peacekeepers and Lisa Westaway from the Kateri Memorial Hospital Centre. But first, we'll start with Lloyd.
Thank you, Joe. Good afternoon, everybody, and thank you for tuning in once again. Just give you a quick update on the local developments in and around our community. This afternoon, we had a Kahnawake COVID-19 Task Force meeting to get a full status report on the situation in our community. We had representatives again from all the major organizations in the community who are helping guide us through this tough time. I could say, as a community, we are in a very good situation in terms of people working together, in terms of having a strong sense of community and sharing resources, sharing knowledge, and moving forward, and how actually, not just the task force, but how the community has been responding, and how the community has been a part of this, which is a model. A matter of fact, we were contacted by outside media, and they're looking at what we're doing in Kahnawake and how things are playing out. And I'm very proud of that, because it shows how we come together as a community in a time of crisis, and that's something that I think many other communities don't have, that sense of community spirit that we certainly do have within our community. In the committee meeting this afternoon, we took a few decisions that would help the overall operations of what we're doing here. In terms of finance, we set up a finance subcommittee to look at the financial impacts on organizations and impacts on the community, to do a little more background work on that, a little more details, so that we have a big picture look at how this is going to impact our community, and how we have to look at ways to adjust the way we are conducting business now and into the future. Along the same lines, another group to get together to look at some of the human resource factors that could impact, again, the community as a whole, organizations, funding sources, on how things operate, because some money that comes into the community is from the provincial government. We get some money from the federal government. We have community dollars and different sources. So how this all plays out and how that impacts on finances and how it impacts on human resources, these are some of the things that we really have to get a good high-level picture of what that looks like. It helps guide the decisions moving forward on how we're going to take appropriate measures. Mind you, dollars and cents and cost of what we have to do is not my concern. My concern is for the safety and security of our people. We also took a couple of decisions in terms of recreational areas. We are going to be ensuring that all the recreational areas in the community, such as the rink, the skate park, as well as the basketball area, have been closed. This is in a measure because a lot of youth have been gathering in those areas and playing sports, and which in any other situation is a great thing. But right now, we don't need to have a large amount of youth gathering together, and especially in playing a contact sport, which further gives the potential of spreading the virus. If some of you watched the news, you see even in NBA, there was one person that was on a team that got the virus, and then it spread very, very quickly to some of his teammates. Even NHL players, they are all told to self-isolate, and so there's reasons behind that. I mean, some are trying to preserve the season if it does resume, but also they know that they're at a high risk if you're together as a team. So that's some of the decisions that we went on today. There's a couple other, there was general discussions about what we have to look at for next week, some of additional measures that may have to be taken, which there most likely will be. We have been, again, watching overall what's happening, and we have been watching the progression of the COVID-19 virus in the province of Quebec, in the general area here. And I could say that we are at the beginning of this. Things are evolving fast, things are evolving quickly, and across Quebec, and certainly within Kahnawake, we are going to have to seriously look at additional measures in the coming days and weeks to ensure that we flatten the curve, as they keep saying, spread out the rate of infection as much as you possibly can. Because if, like was mentioned yesterday by Dr. Jones, if you have 1,000 people getting sick over a 6-month period or a 3-month period, that's manageable. That's manageable. But if you had 1,000 people get sick over a 1-month period, and that gets very difficult to for the healthcare system to support properly the health needs of individuals. And there's a trickle-down effect. If all the ICU beds and all the beds in the hospital are filled with people who have the COVID virus, and somebody has a heart attack, for example, and needs one of those beds, and they're not available. So there is that trickle-down effect that I think people have to understand. I know I said it several times before, but I think it's a message that is worth repeating. So what we're trying to do with these measures, to be honest with you, it's not to stop the virus. It's to slow down the progression, slow down the rate of infection, so that the healthcare systems can manage it, can deal with it properly, so that the essential services of the community and the province, for that matter, can continue to operate, to function, and support our citizens, and they can start to support their citizens. So that's important to note, because I know when it was mentioned a couple of days ago that there was a positive case in the community, it caused somewhat of a stir. And every day I'm getting messages and text messages, or somebody sees me in the street, they ask me, is there anybody in the community who's positive? Right now the answer is no. But we have to prepare ourselves, community, that the eventuality is coming. And I don't want to freak people out, I don't want to be the alarmist, but it's only a matter of time before somebody in the community is going to turn up to be positive. Doesn't mean that it's a death sentence, it doesn't mean they're going to get severely sick, but it means that they're infected and that they have the possibility of further spreading that virus. We're seeing it, the trends across the province, and it's only a matter of time. We live in a metropolitan area. We can't get away from certain things. So I want to say that, again, to be honest and to be real with the community, to ensure that they are aware that the situation is evolving, and it's only a matter of time before certain things, we see certain impacts directly on our community. So with that, we're gonna take it day by day. The weekend is here, but certainly the work does not stop. The virus doesn't stop evolving, and we're not going to stop our work. And we'll be in contact with the community on a daily basis. Tomorrow afternoon, the same time, to give more updates as needed, updates as well as on the radio as required. So I wanted to leave you with that. There's a few other speakers behind me, but I like to wish everybody a best weekend as you possibly can. And enjoy yourself. Try to take time to relax, and just pay attention to the news out there, because it's a big world, and there's a lot of things happening around us, not just here in Kahnawake. So Nyawagoa, and thank you very much.
All right, thank you, Lloyd, and I just want to extrapolate slightly on what he said. And there's a message to younger people, because the weather's going to be nice, getting out there. We're not saying don't get together, but keep some space. You know, don't be all elbow to elbow. Keep some space between yourselves as you're going out there and enjoying the sunshine and walking around. I think that's very important. Coming up next with an update is Chief Peacekeeper Dwayne Zacharie. Dwayne?
Thank you. Good afternoon. Some of the things I wanted to add to some of the comments that Lloyd had mentioned are there are exceptional measures that have been added. So peacekeepers now have different powers that have been granted to them in light of the emergency health issue that we're all experiencing, right? So Kahnawake declared a public health emergency, and with that, it means that this pandemic constitutes a serious threat to our community, and we wanted to take steps, and all of these measures are put in place to better serve you, to better serve our community. And as Lloyd said before, you know, people are looking at us as the example, and we can do a lot of work and we want to do a really good job for you, our community, but it also takes your help to ensure that these things go as planned, right? So as he said, we can't stop the virus from coming. It's coming. But we want to make sure that we can minimize the effect that it has on all of us. So we need your help to ensure that this happens. And some of the additional measures that have been granted to us as the peacekeepers are people who are gathering together, you know, in the public. Really, you shouldn't be doing that. You really have to practice social distancing. But if you're not going to, then they're putting that on us to help people to realize. And first and foremost, I want to stress that our job is not just about the enforcement. It's about developing a relationship with the community. And first and foremost, the Kahnawake peacekeepers want people to comply. If we have to go out there and we have to talk to people, that's what we want to do. But we also want people to understand why this is happening, and it's for your safety. It's for everyone's safety in this community. So some of the additional measures are, if people are gathering and they don't want to comply and they don't want to disperse, right? We have the authority to issue fines, and some of the fines are rather steep, right? And I mean, this is to individuals as well as businesses, right? So the fines range anywhere between $1,000 up to $6,000. And some of the additional exceptional measures are, if people don't want to comply, you could be charged with a criminal offense. But before it gets to that, we're asking people to work with us to comply. We want the community to be safe. We want people to understand that these measures are put in place for your safety, but sometimes, you know, people don't realize, and sometimes people want to push the envelope. We don't want to go there. We want to work with you. So that's why I'm on today, to implore to each and every one of you who's listening, you know, please comply. And if you know other people, go out there and tell them. This is a serious issue, and we want to make sure that our community is safe. We're out there, we're watching, we're checking on businesses, we're making sure that people are following the rules, because we have to ensure the safety of each and every one of you, right? And that means a lot to our community. So as Lloyd had mentioned, people are looking at us, and we are an example, the entire community, but we need all of you to participate and to cooperate. That way we can get through this together with minimal damage. Thank you. Now.
Nyawako, Dwayne. Coming up next is the Executive Director from the Kateri Memorial Hospital Centre, and she is also the spokesperson for the KMHC. We'll welcome once again Lisa Westaway.
Good afternoon. You might be getting tired of our faces, but we're still going to be here for a little while longer. So we first want to just give some global numbers you may already have seen, but the total world cases is up to 266,082. We have a total number of deaths at 11,153, and a total amount of people who have recovered at 87,363. So there are a lot of people who recover. That's the first message that I want to make. But there are a lot of deaths, and we have control over that right now, immediately. We have to make a difference. In Montérégie area, we're at 21 cases, Montreal 31, and so for Quebec, a total of 139 cases. these numbers are increasing daily, so we're not seeing anything go down. It's not because we haven't identified any positive cases in Kahnawake that it's not going to come here. We do not have a protective bubble over our community. So we are going to see cases. We're going to see them very shortly. As Lloyd mentioned, I think it's important that we keep that in mind. The message is not that we lost the game when we have positive cases. And I think what we want to really share with the community is that it's not going to be a time for blame. It's not a time to say, well, it's this person's fault or that person's fault, or they traveled and they didn't self-isolate. Although we have said on numerous occasions that it is people's individual responsibilities to have an impact on the collective, we want to be careful that we also deal with this as a collective. So it's just a little message that we wanted to bring. And it's really important that we, in the coming days and weeks, that we stick together, as Kahnawake has done on numerous occasions. We deal with the information, we pull up our pants, and we strengthen our resolve, and we continue to put these efforts in place as much as we need to and as consistently as we need to over and over again. So this is the message that I want to bring to you today. We know, and just to bring it home a little bit more, we don't have numbers on the amount of people in Kahnawake who have been tested, but I can assure you that there are several people who have reached out to the 1-877-644-4545 number and who are currently being tested. So as I said, it's a matter of time. We don't have access to numbers of how many are being tested from our community. Those are not provided to us, and people call that number on an individual basis, and we don't have that information, but we do know that we have referred people to that number and that they are being tested. So it's just important to kind of set our mind around that we are going to have positive cases and we're preparing for it, and that we need to respond as a community. And so because of the increase in numbers that I've talked about, that Lloyd had talked about as well, we're going to be working over the next few days to look at what are the next measures that we're going to be implementing. So we want you to be prepared for that. We're, like I said, we're not letting down our guards. It's not because there's no positive case today that we're going to stop this fight. We know that it's a fight that's going to last over the next few weeks that we need to keep working on. And remember, as Dr. Jones said yesterday, we have some control. This is not totally out of our control. Our control is, if we're asked to self-isolate, that we do so according to the criteria and according to the steps that we've documented. When our social distancing, that is a huge control that we have. We have to continue to do that on a daily basis, hourly basis. We have to ask our children, our seniors, anybody, we have to explain it everywhere we go. We have control over washing our hands, soap and water, constantly washing your hands. We have control over our respiratory etiquette, how we sneeze, that we throw our Kleenex out as soon as we use it. These are the things we have control over. They sound small and unimportant, but they're huge, and they have a huge impact on the outcome of how our community will get through this. The last thing is the 1-877-644545 number. It's the measures that the ministry has put in place have really facilitated access. So we know that people have gotten through a lot more easily than they have in the last few days. So always call that number for information. And if they think that you need to be tested, they'll refer you. And many people are being given appointments either between less than 24 hours up to 48 hours. So the access is a lot easier, and we're seeing results also more quickly. So please follow the measures that we're asking of you. We will be here tomorrow to give you another update. We could have new measures to share with you tomorrow, but we ask that we now strengthen our resolve, we work together as a community, and we will get through this. Oh, actually, one last thing, and this is a very important point that I wanted to make, was a thank you. So a thank you for all those who are working day by day through the stress and anxiety in order to provide service to our community. A thank you to those who are at home, who are taking care of all of those who are at work. That's just as important for everybody's mental health. So a really big thank you out there to our whole community who is following the measures that were implemented despite the hardships that they're going through. We thank you. So.
All right, thank you, Lisa. Thank you very much. As I do my own thing and make sure I wash my hands, that's a habit we all have to get into. Just a little reminder that, as to paraphrase, basically, we can't stop this, but we certainly can manage it. Just a couple of housekeeping notes here before Lloyd comes in for his final words. A reminder that we'll be doing this every day, 7 days a week over the next little while to make sure people have up-to-the-minute information. For those who have heard it on the radio, didn't maybe caught the tail end or whatever, you can also, of course, for those watching live on Facebook, at Kahnawake 911. You can repeat that message. Let people know who don't have the internet that they can watch it on Paul's cable, because now we have taken care of some of the technical glitches, and you will be able to watch it on Paul's cable. It will repeat, and of course repeating as well, and probably as you're listening on K103.7. So with that, everybody have a great weekend. We'd like to finish up with our Commissioner of Public Safety, once again, Lloyd Phillips.
Thank you, Joe. Once I had finished my last statements, I just went back through my notes, and I came across a couple things I wanted to address, because these are some ongoing questions from community members, and some of them is to answer some questions, a couple of questions, but also to maybe help people understand the situation maybe a little bit better. Well, first of all, people are concerned about income. And I mentioned this, I think, yesterday, but we do have a group of people working very hard and looking at options on how people who are impacted are financially supported. We don't have any concrete answers for you yet, but rest assured, these things are being looked at. And something we will have more information for you in the next few days, as soon as we have some details worked out. A couple of questions about the schools, on whether or not the schools are going to be reopened next week. We had a meeting today, and Robin Delarone was part of the discussion, and we're going to have that on the agenda for Monday, on whether or not the schools are going to be reopening, and after the 2-week shutdown. It's something that we have to look at, but it's certainly not looking very positive at this point in time, to be quite honest with you. But we're going to officially address that on Monday. Another question was asked about sale of alcohol in the community. Should the convenience store stop selling alcohol? And the short answer at this point is that's not something that we're looking at locally in Kahnawake. Main reason for that is if we could theoretically say yes, we're stopping all sales of alcohol in the community, and then if somebody wants to buy alcohol, they could just drive down the road to Chattagee and buy what they want. And by taking that measure now, basically we're just going to be putting more people out of work. So that's not what we want to do. We want to take measured responses, logical responses, and look at the whole big picture around us. If it comes to the point where either other places are closing down in and around or around the community, in the province, and so on, that's something we'll have to consider. We're trying to minimize impacts on individuals as much as humanly possible, have people live their lives as much as humanly possible, but we know that's very difficult, and that topic obviously can be readdressed as time goes on, but that's where it is for now. One of the other questions that somebody had it was really, I think it stems to some of the fear that some people may be feeling and saying, are we heading towards a lockdown as we've seen in some areas around the world and even some parts of New York City? No, that's something that we're certainly not at that stage yet. But things are evolving fast, and the progression of this virus is fast. I'm not going to stand here and say no, that's never going to happen. But I will say we're not at that stage yet. And as things evolve, if more and more measures has to be taken in the community or around our community, with the province or in the states or with the border issues, we'll have to adapt and find a way to navigate our way through that. So it is something that we have to keep in our back of our minds, and hoping that all these strong measures taking place, people being compliant, listening to the advice that's out there, we won't have to go down that road. So everybody has a responsibility, as was mentioned already, and our responsibility as a community is to support one another, but also remind one another. If you see something that is not right somewhere, point it out to your family, your friend, your cousin, or whomever, and say, did you wash your hands? Did you do this? Or you should not be doing this. It's important. It's important because we need each other, and we're going to be in this for the foreseeable future. And without the support of each other, then honestly, we'll be just like everybody else out there. We're Kahnawake, we're special, and let's keep it that way. Yawa.